if anything was proven during the pandemic, was the value of telehealth. Where I see that we could really use AI is with mitigation strategies when it comes to opioid prescribing. What we saw, for example, with ketamine being used for depression, it was really misused. What I've seen in the research is that they're looking at psychedelics specifically for things like headaches and cancer pain.
Can mindfulness apps be as effective as in person therapy for pain?
Yes.
Today, I'm joined by Dr. David Cosio, a clinical psychologist who specializes in the link between pain and anxiety and modern approaches to pain management. Lovely to meet you, Dr. Cosio. Thank you for joining us.
It's very nice to meet you, Catherine, and thank you for having me on.
So, David, we are starting with our quick fire round. So, I'm going to fire some quick fire questions at you. Please answer them as quickly and as briefly as possible. Sound okay?
It sounds great.
Brilliant. Question one: what brain region is most implicated in both chronic pain and anxiety?
So there's three separate areas of the brain that are responsible, right? There's the somatosensory cortex, which is right here on the top of the brain. There's the frontal cortex, which is here in the front. And then there's like a nut in the middle of our head, and that's the limbic system. So those three are involved in pain. And then the limbic system and the frontal lobe area is it's involved in anxiety.
Excellent. What is one promising non invasive technology for pain relief?
Yeah. So what if anything was proven during the pandemic was the value of telehealth. Telehealth, I feel like, is the best tool for pain management because we're allowed to reach the patients that maybe are not in the more urban areas, but also it's convenience and flexible, right?
Very good. How does AI help personalize pain treatment?
So that's kind of in the infancy right now. I think the implications are really wide. Where I see that we could really use AI is with mitigation strategies when it comes to opioid prescribing. So here in the States, there's a lot of things that we have to do in order to prescribe an opioid. And a lot of physicians and providers find that very cumbersome. And so AI could quickly put that together and make sure that that information is collected and done. um, I've also seen research looking towards like helping with diagnostics, which can be helpful, but I'm worried because I don't want us to rely on it.
Yeah, absolutely. What are your thoughts on psychedelics for neuropsychiatric treatment?
So this is actually a pretty sore subject for me because here in the States, again, that's all I can speak to. What we saw, for example, with ketamine being used for depression, it was really misused
Mm,
and kind of, used too early in the process. There's a lot of other things that are standardized treatments for depression that should be done first. So it could be used as a last resort, but again, I think it's too soon to say.
okay. Are there any psychedelics being studied for pain relief in particular?
So what I've seen in the research is that they're looking at psychedelics specifically for things like headaches and cancer pain. But again, too early in the research. You don't want to base any decision on one study, right? You want to make sure you have multiple studies finding the same thing. So I think that they're starting that now.
Fantastic. Name a mindfulness based intervention that helps with chronic pain.
Yeah. So there's something called the mindfulness based stress reduction intervention. It is a combination of mindfulness and meditative practices. We use kind of an abridged version. And a lot of times that's because, people have a hard time kind of keeping up with it. But it is a good way of introducing people to the practice and getting them on their way.
Great. And what's one innovation in pain management you're excited about?
So there is something here that we use that's called cranial electrical stimulation. It's very similar to ECT that you would use for
Mm,
like severe untreatable depression, except it's 9 volts. And anyone who has a centralized sensitization can benefit from it.
very good. Right, you did really well there. So now some yes, no questions, even more succinct. So question one, can genetics influence how someone experiences pain? Yes or no?
Yes.
Do social factors affect how people experience chronic pain?
Yes, absolutely.
And can mindfulness apps be as effective as in-person therapy for pain?
Yes, but I'm gonna put an asterisk on here. It really is dependent if the person is doing it, right? If they're actually practicing. Just owning the app isn't going to help you. You have to actually do it, right?
Compliance. Okay,
Yeah.
brilliant. Great. So well done, you. That's the quick fire round done. Stay tuned for the upcoming deep dive episodes where we delve further into chronic pain and anxiety. Thanks for listening.